previously used to using Apple, because I was putting my fingerprints all over the screen. Oh, they turned it off. Okay, we're good.
Thanks, Jack. All right. Thank you, Jack. I appreciate that. It's hard to hear others talk about yourself, and so just a little warm, but thank you. Really want to say thank you very much for allowing me to come and share and be a part of your day, part of our day. But before I began, I wanted to say a little bit about truth and reconciliation. To recognize the National Day for Truth and Reconciliation and Orange Short Day took place yesterday, September 30th, but just wanted to let people know that in the OPS, we're actually observing Monday today as our National Truth and Reconciliation Day. So as we work toward meaningful and lasting reconciliation, the OPS is engaging in meaningful and real thoughtful events with our Indigenous peoples at all levels. So as part of our understanding, learning about how through the different years, exploring the rich, diverse cultures that exist and those experiences with our First Nations, Indigenous brothers and sisters, it's our collective responsibility, especially when we talk about the Truth and Reconciliation Commission call to action, especially call to action number 57. So as we try to champion those meaningful changes across the system, because we know that it is important to address systematic racism and all forms of discrimination. It's a journey. It's not going to start and stop today. We're all at different parts of that journey, but I just wanted to let everyone know that at least in the OPS, we are committed to the ongoing processes of truth, reconciliation with our Indigenous and the territory that we live and work in every day. So we hope that by each passing year, the communities, our societies, our workplaces do become more inclusive, more aware of the strengths that come with diversity, both of experience, perspective, because as we continue, it's about that journey together. And I want to say once again, proud to be a partnership here with our colleagues at the Center for Research Expertise for the Prevention of Musculoskeletal Diseases, CRE-MSD. So the ministry, my office at the Chief Prevention Officers, we've been a very ardent supporter of CRE-MSD for many years, excuse me. And the work in the Research Center does for the health and safety is so important, and I just want to say thank you very much for that work. So as you know, on October, Global Ergonomics Month. Exactly. Global Ergonomics Month. And I was trying to find something a little more punchier than to say this is a great way to start on the right foot, but I couldn't think of anything more. So, but once again, speaking with the individuals that set up the program today, a lot of diverse people, diverse audiences, so employers, workers representative, management, human resource professionals, health and safety professionals, ergonomists, government, researchers. We're all here. Right people, right place, right time, to talk about a very important item and a very important issue that still is with us every day from a standpoint of worker and individual health. So one of my roles as the Chief Prevention Officer is to develop a health and safety and prevention strategy that we also want to put into action. And we have that. It's called Prevention Works. Year 2.5, Aaron, it's amazing. 2.5 years of having that plan in place. And one of those objectives personally for me, as Jack said, I was in school for a very, very long time. But it's how do we use and target the evidence? How do we use and target data to both understand where we need to create those initiatives? More importantly, where do we find ways to measure the good work that's being done? But also, is those initiatives or are those initiatives actually working? Because now you may need to evaluate and do something differently. And that is okay. But it's about using the data and using evidence to build knowledge and that's what we want to have at the workplace. So that's why, once again, the ministry, we have currently a year-long MSD compliance initiative as an example. So it started in April of 2023, and it's going to go to March of 2024, looking to find ways to conduct the health and safety campaigns focused on MSDs, especially in healthcare settings, because we know the data tell us that MSDs are a leading cause of lost time injuries, as an example, and we know that by focusing our compliance, our education aspects, we can make differences. So once again, using data with our colleagues to focus initiatives to make change and find ways to make improvement. Amazing when it comes together, all right? So we focus our results because the data, that is where it tells us and what to do. So moving along, see today, you hear from some great speakers to just echo and amplify Jack's original comments. Sectors where we know that MSDs are prevalent: healthcare, construction, and already given a shout out to our colleague Erin Oliver. She's going to be talking some about the construction sector, and Erin was our past chair of the Prevention Council. So, as also Jack says, I don't want to hear my voice, I want to hear the great speakers, so I will come to a close as well. But how do we shed light and share the knowledge that exists amongst all the experts that are in this room? Because this is a very important puzzle piece. Musculoskeletal disease, musculoskeletal injury, as it relates to health and safety. So I want to say, Jack, thank you once again for all that you do at CRE-MSD and the focus that you provide us at both at the ministry. You help me to be honest, and I appreciate that. And once again, thank you so much for all of you being here, because the system needs your support and efforts. Thank you so much.